So welcome all. I wanted to see if anybody from DHHS is with us today. I know that they've also been very busy too, but in case they are, could you introduce yourselves? Hearing none, I will go on and have everybody sign into the box, as I mentioned earlier, the chat box. I do think that what we'll do today is just quickly review some of the things that we talked about last week if you were not able to listen to the recording or even be on last week's meeting or call. We talked a little bit about how things are going here at NPHL. It's busy. Fortunately, we are working 7 days a week. We are doing anywhere from 300 to 400 specimens. So as you can imagine, it's a lot to do. What really helps though, Emily hopefully will be on later on in this call to go ahead and give a little bit more detail, but I know what really helps them is to be sure that all specimens are put into the new alert system, which really does allow for things to streamline and go much easier here at NPHL. So I will table the state of testing here at NPHL until Emily can be on. And I had also hoped just to briefly review the additional collection kits. With that, Brittany, are you on? And I might table that as well.
Hi, I'm here.
Ah, there you are. Thank you.
No problem.
Brittany Harrington is with our DHHS folks, and she is the one who is coordinating all of the requests for not just COVID media that is required for testing, but all other supplies, PPE and everything in the field. So Brittany, would you clarify that if I said anything wrong there as far as your responsibility?
Nope, that's correct. For this COVID incident, my position is basically called the logistics section chief, which means that I oversee any of the PPE distributions, any sort of other resource requests that we receive, in addition to the viral media testing stuff that NPHL is doing.
And just explain why we've had to go to this methodology now, and whereas in normal situations, it would be a simple order through our NPHL website. But I'll let you explain the requirement.
Sure. So part of the reason that we transition to this is we say that all responses start local. And in this incident, your local health departments are considered the lead agencies. And so it's important for them to have situational awareness as far as what is happening in their communities so that they can plan any of their efforts around what they're seeing locally. Then having it go to the DHHS ESF8 box, it allows us to try to assess for greatest need, knowing that we have limited resources. So I actually just kind of collect the requests and then kick it over to our EPI unit. You know, in a different situation when resources aren't so limited, we wouldn't have to have so many built-in factors. I know that I've seen requests that are much larger than we're able to fill, so we're filling smaller to try to spread that resource around. It also assists me in kind of seeing how many requests that we're getting, so that when I'm in meetings with procurement and FEMA and the CDC, that I can re-emphasize how many requests we're receiving, what sort of request amounts we're receiving, what we've been able to fill versus what we haven't been able to fill, in a way that it doesn't create me having to go to figure out this information when I get calls from FEMA or CDC, which sometimes can be, you know, they heard that we are having a need. They want to know the need in the next 2 hours to try to get us something. So having a little bit of visibility to that also assists in me fielding those questions.
Perfect. Thank you, Brittany. I'm going to open it up to any questions. Just as a reminder, what Brittany is recommending is that there is a special form that needs to be filled out. We talked about last week. If you are not familiar with that form, text me later or email me. I'd be happy to share that form with you. But can I open the floor to any questions for Brittany and any questions on this special form? It's called the 213.
And just to reiterate, that gets sent to the local health department, correct?
So did you have a good weekend?
Yes, it does. It goes to the local health department.
I know.
I hear voices in the background. I hear somebody talking. So if you could please put your speakers on mute, or your mic on mute. Thank you. Yes, and thank you for that clarification. It does go to your local health department. I've always encouraged that you actually give them a call to know that it's coming, because they're very busy people too. So you want to make sure that they're aware that you need it as soon as possible. So any other questions?
This is Robin from DHHS. And just so you know, we do, if you do not send it to the local health department, we do reroute that back to them. So it does take more time for the request to get filled, because the request has gone to either NPHL or directly to DHHS or somebody else before going to the local health department. And so we do have to send it back. And so they know what's going on in their jurisdiction. And so that does take more time for the request to be processed. So if we just send them all to the local health department first, that makes everything more timely.
Thank you, Robin. Glad to have you on. All right. Any other questions?
This is Gerald from Syracuse. Hey, Brittany, I got on a little later. So we're talking about large volumes, small volumes. Can you may have said something already on what that perspective is. Give us an idea of what you consider small, because I think a lot of us, we can keep those, you know, small and frequent versus large and less frequent on those orders. I know we can here in Syracuse. We don't have a ton of cases, but, and I just put a request in for some tips. We actually ordered a bunch of the PBS early that we have on hand. So we're not going to get that from you guys, so you can divert that to someone else.
Right. So it's, I guess I don't have the expertise as far as reducing people's orders or what NPHL has on hand. So that's basically the ESF 8 box kind of just functions as a collection point, so that if for some reason, you know, the EPI team was out, or the individuals that I forward this to in the EPI team were out, or the individuals that I would forward this to at NPHL are out, that it's not just sitting in someone's email box, and that we can, you know, redirect that, also see, you know, higher priority ones and make sure that everyone's on the same page. I know recently, and Karen, correct me if I'm wrong, that we've been sending out, like, you know, if you submit a request, we can only give you 25 at a time or 10 at a time, or whatever that number is.
And certainly I can speak to that, Brittany. We have, I confess, have experienced a very big shortage. In fact, this weekend, we were afraid we might have to stop. But as it turns out, at the last minute, we were able to get another 1,000 collection kits. So with that, we'll keep going. I hope that lasts several days. So that it does explain, Gerald, why we have had to kind of limit it to 25 at a time. However, if you do have an outbreak in your situation and do feel that you need more, certainly talk to your local health department. That information will be passed along to us, and we certainly can fill it if need be. So we're just trying to count our P's and Q's here. Also, a reminder that these swabs do need to be used only for NPHL. So unfortunately, if you're using other labs to, excuse me, other laboratories to send to, unfortunately, you have to take time to separate out your inventory. Make sure that, I know that's hard and that's a lot to ask in this busy time, but we just want to make sure that the swabs we send out are coming back to us. It's very important. So thank you. Thank you, Brittany. I think we'll go on for time's sake. Teresa, are you on?
Yes.
Hi, Teresa.
Hey.
So last week we spent a lot of time, didn't we, going through step by step how to enter into NULERT. We find this very important, as I was saying, to expedite these specimens, because if we have to enter it ourselves, right, it takes more time and may miss a run, and we'll have to wait until the next run. All right. So I thought what we would do today, not go through every step by step, but I thought I'd open it up to the whole group and see if there's any questions on NULERT. Any experiences, difficulties you all have had out there, please.
Can I make a quick little comment? So I do want to say that so it's really important that you do order these and that you don't use the manual requisitions if you can avoid it at all, because like Karen said, we're getting about over the weekend one day, I think we had 500 orders, and a big majority of those we have to put into our system. So if you can, it's easier to take the small amount you're sending, put it in NULERT, and then us at the main lab only have to get the instrument ready labels on each sample. So that's one thing. And then the other thing that's really important, and we worked with Robin Williams this last week to really perfect the criteria on deciding if something is low or high risk. And so it's really important to look at that criteria, make sure you're selecting the right algorithms. And if there's something on there that you're not familiar with, or if you're like, well, how do I put this type of, is this high or low risk? So if there's a question, feel free to send that our way, and we would be more than willing to help you work through if it's high or low risk. The important thing about not marking everybody as high is then that means that every high specimen gets tested, whereas the low specimens can be pooled, and then NPHL has more capacity to run more specimens and get results out quicker. So just keep all of that in mind as you're ordering, that those questions, they're the very first thing you enter, and they're extremely important.
All right, thank you. In fact, Teresa, you remind me that we have put in a new, it's a paper NPHL requisition, and I'm not trying to promote the paper, but if you want to see some of the newer categories, you can go on there and see what it's like. But again, we would much prefer that you put these in NULERT. You'll see those things in NULERT as you order. And thank you from hearing from everyone that NULERT, it sounds like it's been easy to use. Some people have said they like the drop-down boxes, so I'm really glad to hear that. And certainly let us know if there's any problems. That's just really, really important. All right, so that the way to get into NULERT or to sign up is on the nphl.org website. There you can sign on. And did we talk about last week, Teresa, too, the reason why you want to get a full account or do the quick account? Is there a difference there?
Yeah, so you would, if you do the quick account, you're really limiting yourself as far as getting results for your entire facility. So what you want to do is if you know that your facility already has an account, then on the nphl.org webpage, there is a link right under the link for new alert. And I don't know, Karen, if you want to pull that up. And there's a form on there that you would send to one of our IT team members who can build you into that account. So then in the future, you can see all of your results that you've entered, as well as all the results that have been entered for your facility. So, and we have been opting to just build the facility accounts if we can, because of that luxury of being able to see your full results. And it's only taking us about 5 minutes to maybe a few hours to build those based on if our IT team is in a meeting.
Can you
So,
see it,
yeah.
Teresa? Is it there?
I can, but you want to go over to the left a little bit.
I don't know how to put it to the left here.
Maybe just minimize your screen or your just that internet browser and then move it over so it's not full screen. But it is also important to use Google Chrome when you're ordering. I guess that's another kind of quick tip. Yep, and then just move it to the right, I guess, now.
That right?
Yep, perfect. So you can see the big bolded, it says new alert, and then it says login or sign up. So if you do not have a user account, it is really best to sign up and indicate your facility on that form and then email it. And like I said, it's only taking about 5 minutes.
Once you have, yeah, you can sign in. But here's the point at which you can, if you need to immediately register, goes there. So again, I'll open it up. Any other questions for Teresa?
I do, Karen.
Yes.
It's Jess at CoVID Community Hospital.
I
have my own personal new alert that I've been having everyone order through. Is there a way to make that a facility one now so it's a little bit easier? Or do I need to just create a new facility one?
Nope, go ahead and just email fill out that sign up form for every user you have, and then your account will then be migrated into that facility account that gets added.
Okay.
And so all those results should hopefully show up.
Okay, perfect. Thank you very much.
Any other questions?
Just a quick question, Dan in David City. Where's that form for ordering supplies located at?
It is on our nphl.org website. You'll find it right on that front page. It'll say on the top, Hot Topics. Below that is our HON. And then I believe—
You want to pull it up, Karen?
I just brought everything back down, so I'm sorry.
Oh, sorry.
Yeah, that's all right. But Dan, you should be able to see it if you pull it up. If you can't, just give me a call. So.
This is Gerald from Syracuse. Hey, Dan, on some of that forms though, we're just putting that through our instant command people. So our emergency preparedness coordinator is just throwing that on with PPE requests and all that stuff. So they're filling out the form for us actually. So us in the lab are not doing it. So you might put it with whoever's filling out those requests for like N95s or isolation gowns. We've been throwing it in on that same area.
And that should be okay. Good idea.
That all has to go through the health department too. So that way it's just one stream.
Yeah. All right. Well, thank you for all your comments, and I appreciate hearing from all of you. All right. I think with that, thank you, Teresa, unless anybody else has questions. Okay, we'll go on. I wanted to speak just a little bit today about safety, and again, I'm going to change my screen again. I'm just not as used to this as I usually am with my Adobe Connect. And here I wanted to share with you, this is from our APHL and it's our APHL friends that have put out a presentation. We talked a little bit about this a week or two ago. This is available for continuing education, but I pulled out of it just a couple of the slides that I really wanted to show you. So in this day and age, since things are so different and it's requiring us to do this kind of testing, and we have a bigger risk of COVID specimens coming through our laboratory, it's very important that you look at your testing that you do in your laboratory and do a risk assessment.
No, 12 now.
So I would recommend that you reassess.
What day did we move in? What was that, Friday?
Is somebody talking in the background? Can you put yours on mute, please?
Let me see here.
So in the risk assessment, obviously, is to gather the information and identify the potential hazards, also to evaluate and prioritize the risk. Eventually, we will determine what the additional safety precautions are, what extra PPE you have, and then how to reduce that risk. So we want to list our steps of mitigation. At that point, we want to implement that mitigation and those controls to mitigate the risk. And then what we'll do is we'll monitor the changes and review and reevaluate its effectiveness.
I think I did, but I also think I've got some in here.
So does anybody need help to get on? I hear talking in the background. All right. With that, it's important then to review incidences. I would hope that if there's any spills, that your staff knows what to do.
Oh, that's okay.
In case of a spill, please do remind them during this time. We would also like to identify any problems, discuss it with your group. If you're making changes, make sure that they're trained, make sure that it's documented that they've trained, and you maintain those records. And it's really important, as I said, to monitor those new changes. You know, it's not meant to point fingers, it's just meant to help the staff know and how to do it correctly and to be safe. One thing I think is important that the risk assessments are written down. I do find that sometimes it's just an easy thing to say, okay, well, here and here and here's the problem. So you think through it mentally, but really you need to write it down. So you've got documentation that it's happened, and documentation that you've trained, and that if there's ever a problem and you are inspected, obviously you'll have to show that written process. So so in order to perform a risk assessment, of course, you have to do the job hazard analysis. It really breaks it down into the different components. And that's what the continuing education goes through, all those components, and then evaluate each step. A little bit more about job hazard analysis. I didn't want to necessarily talk about this morning, but again, it's just associating that individual hazard and then finding a way to mitigate it. So the 5 Ps being the pathogen, we know at least what this pathogen is, the people, your staff, the place, your laboratory, what PPE are you wearing, and what do your procedures say about it? And here is really a simplified version of it, but that's all it needs to be, is just something written down column-wise to say, okay, like the catalase test, what are the principal steps? And as we know, catalase does have some aerosolization, so you're observing for bubbles. However, because it aerosolizes, it creates a hazard. There are also additional hazards with chemicals and sharps as well. So does this test need to be done in the biosafety cabinet or not? Well, maybe it just can be done behind a face shield, or with staph and streps, we've been doing those for years on the bench top. Not necessarily a perfect way to do it, but can you do something behind a desk shield or a face shield? That would make it easier. And then knowing what organism you're working with, it's also important. So if you have a potential hazard organism such as, say, Bacillus anthracis, Francisella, or Brucella, obviously those being more dangerous has to be done in a biosafety cabinet. All right, so they talk a little bit of the second to last column, administrative controls and work practices. So that's what you're going to list here. Just as you see, it's just very brief what your changes are going to be from before. And then the final column, of course, what PPE you are now encouraging them to use during this time. So you go through this whole process even with, say, for instance, the hematological, sorry about that, differential. You can do that. You can do this with any type of testing within the laboratory. So again, remember that there's risk, some risk in everything we do. We cannot eliminate it, but certainly we can try to eliminate as much as we can. So ask questions, make sure your staff is trained, evaluate, and always review and adjust. It's a circular process, just like exercising is. You exercise it, you review it with an AAR, or after action report. So obviously it's just a matter of making those quick documentations of what you did to prove, or what am I trying to say, that you have gone through this process. All right, and that's really all I wanted to remind people. Again, I encourage you all to walk through that, and I would say specifically with your any respiratory type testing. So if you're doing BioFire respiratory panel, I would highly encourage you to have that risk assessment on paper. So I'd like to open that up to any questions that you might have about risk assessments. And I'd love to hear from you as to any examples that you have, and if you've done one in your laboratory. Please share. Don't forget to take your speaker or mic off mute. All right. Okay. If no questions, I'll go on. What I wanted to next do was to share some stories in the field. And I'm going to rely on you to all help me out with this part. I'm going to start with sharing some of my National Guard experiences, but I know National Guard has been in your areas as well. So I'd like to hear what you are experiencing in your laboratory right now with the COVID-19. So with National Guard, our governor, Governor Ricketts, has asked our National Guard to stand up, especially in the hot spots that we deem very important to make sure and get information out as to how many are positive. And as you all have heard lately in the news, it appears that our biggest hotspots are our processing and packing plants, some nursing homes as well. But Nebraska, being the agricultural state that we are, it is very important that we keep our facilities open. So we have gone out to a couple of these. We've been at it for 2 weeks with National Guard, and we're an instrumental, NPHL is an instrumental part of that National Guard stand-up. In reality, we are the ones, or actually it's Teresa's group that does the coordinating of getting all the specimens out there, specimen collection kits, excuse me, and the shipping boxes, and the frozen, well, no, we can't freeze, but the gel packs. So those are the kind of things that we may have had to send to your laboratory to get out to our National Guard group. With that, they will try to do anywhere from 50 to 100 specimens a day. And we are sincerely trying to get this in Newlert. There's been some glitches along the way too, but in all reality, even they have been using Newlert, which I think is really a great accomplishment and a lot to say for Newlert too. So with that, it's been, I think, helpful for the state to know where we stand, and therefore I think we're going to continue doing this process probably for another 2 weeks. I think at this point it'll be through our peak in Nebraska. As you know, both coasts have peaked. Nebraska has not quite yet, so I envision that will still be coming. All right, I'm going to open it up, and I'd like to ask if anybody from any of these areas would like to share any of their stories. What have you seen out there in the fields? Somebody just let me know what's happening in your lab. Hi, Allison. I see that you're on. Do you have
Yep,
any?
I just dialed in.
That's fine. I'm glad you're on. Allison is from DHHS, one of our lab liaisons as well. So glad you're here. Do you have any stories from DHHS you'd like to share?
I think we're in the process of getting our hind together, because I know the feedback from the local health departments have been, you know, the testing is still pretty restrictive. And so they want to open that up because they have, you know, people that are symptomatic. They have workers from packing plants that have symptoms that just aren't able, that don't meet that criteria. So we're working on kind of opening that up.
That's perfect. Yeah.
I was curious.
This is Robin.
Teresa. Oh. Go ahead, Robin.
Go ahead, Teresa. Okay. Well, yeah, we already made that change in Newlert, actually. So you do have that opportunity to just order on pretty much any patient that is symptomatic with for COVID at this time in Newlert.
And
the HON will be coming out.
Yeah.
Well,
and asymptomatic, but part of that large group. Isn't there large group surveillance?
Yeah, but those are for specific groups. We'd like them for individuals that come into the office. You know, we would like them to meet those criteria of being symptomatic with COVID. But if it's in a large group setting, like a long-term care facility or healthcare workers, you know, that we need to test and get back into the or these processing plants. You know, we want to know what that risk is, but testing asymptomatically is not always, it doesn't do the greatest things, but it could potentially find a positive. But you also, if it does come back negative, it doesn't mean that you're necessarily not going to be getting it in the next 2 days. So those are the kinds of things that we really want to be aware of when you're testing asymptomatics.
And Robin, this is Karen. Can you go into a little bit more detail about the HON that will be coming out? I agree with Justin that physicians are somewhat still very focused on that more tight criteria that we worked on at one time. So,
yep. And that's exactly what this HON is going to say. It's going to say, please test your patients. It's going to say there's availability at commercial laboratories, there's availability at NPHL. Some laboratories have some of the rapid testing available now. Some of the bigger laboratories are getting additional equipment, so the capacity is grown. And so the reference labs are doing a lot better with timeliness, most reference labs. So this is a time to test, and we are encouraging it. So that's what the HON will say, to encourage providers to test their patients.
And when do you expect the HON out?
It's pretty much done. It just is going, right now it's going through approvals. So hopefully by the end of the day.
Okay. And we will share, will that be shared with our laboratorians too, or will you allow me to share with laboratorians as well? Or does it?
You can share it, but it'll also go out in the HON to the labs specifically.
Okay. All right. All right. Thank you. Thank you. I have a question. Can regional accept additional tests? Thank you from Children's. Yes, I do know that they are taking specimens. The difference between regional pathology here in Omaha and NPHL, we're on the same campus, but our testing is paid by the state, whereas most other testing is a commercial pay, so something that the patient will be charged for. But I know that they do have availability. So please look into that. If you don't know a contact, I'd be happy to share that with you all. And of course, really, Teresa, you're the one to contact for the regional pathology work as well.
Yeah, the good news is that we just, we're going to go live with a serology test at the end of the month. So watch out for our lab alerts there. We also are taking, we sent a lab alert out, I think Friday or Thursday evening, and we're taking saline now. And we're also really excited that we have a 3D printed swab that we're sending out. It's neon green now, but it might be a different neon color based on how many get printed. And we're really doing some big innovative things. We do have an opportunity as well to make our own media in-house too. So if you don't have to use saline, we do suggest not using it. So I did have a couple of things I wanted to say too, is that I just wanted to ask, how are things going now with the couriers? I feel like this last weekend went a lot better as far as from client services perspective, based on these hub locations. I didn't get nearly as many like rapid calls, so I didn't know how everybody feels about that. Okay, it must be going well, and I just want to thank all of our hub locations as far as them accepting specimens from other laboratories and getting them back to us. It really is saving down on cost and helping expedite specimens to get back to the main campus quickly. Somebody had a question about, is there any recommendations, direct viral versus serology at this point? You know, Mayo Lab just came up with a new test code, And so they have a little bit of guidance on there that you guys could look at. But otherwise, I'm sure when the lab alert goes out, there'll be some guidance.
And Teresa, you said it by the end of the month?
Yeah, they're hoping by the end of the month, and it's on the liaison.
All right, it'll be good to know. A lot of people have a lot of questions about serology. NPHL has not had the capacity to research this, so we're very glad to hear that you are. So are you aware of any other serology out in the fields?
I just know Mayo so far.
Okay.
Mayo Medical Labs.
Yes, thank you. And does anybody else have any experience with serology testing in the field?
I do believe there are a couple laboratories out there looking into it. And I am not sure about the FDA approval for those yet. So that's something that we do need to look into, and we do need to discuss with everybody. Teresa, is that one that is going to be done up there? Is that an FDA approved test? Or you know that?
Maybe I shouldn't. I was premature in saying something, but I don't have all those details. But definitely a lab alert from regional lab will go out. As of right now, I'm sure, I'd like to think that it would be FDA approved, but at this point I just can't say.
That's all right. We have a couple questions here. It says currently UNMC was asking we send testing for inpatient placement or employees only. Will this change along with the HAN to be symptomatic patients regardless of being inpatient or employee? So a symptomatic outpatient.
That is most likely a UNMC protocol, so they can change, do that based on our HAN, but that is pretty much up to them.
Okay. Children's also comments that they're using for serology a Viracor. I'm not personally familiar with it, but that is another option out there if people are looking. So let's see, then another question is what is the sensitivity and specificity? Well, I suspect that's not out yet, and I suspect that we should wait until it's out really to say anything, or Teresa at this point?
Yes, and same thing with IgG and IgM, that question. Yeah, we'll get you guys the data, but I just wanted to make sure everybody knew that it was coming.
Hey, Karen, this is Pete.
Hi, Pete.
Serology is a dark hole that people need to be very, very careful with. There's only three commercial companies or kits out there for serology that are FDA approved. There's been a lot of requests for people to use these serological tests. I'm on a task force with APHL and the CDC to discuss these assays. And the bottom line is that there's a lot of what they would refer to as snake oil out there being sold. And the sensitivity, the performance of these assays are not very good in most cases. None of them, even the FDA approved tests, have not been studied under clinical conditions, believe it or not, that have been licensed. And none of these tests can be used for diagnostic purposes. So everyone needs to be very careful about even interpretation of these serological tests, because nobody really knows what the results mean at this time. So I just want to caution people that it doesn't really matter. If you look on the FDA website at the sensitivity specificity of these assays. The companies are going to say they're 99%, 95 to 99% good tests. And it's all been prepared using very low numbers of tests. And it's all been done using contrived samples in most cases, which means they're using fake samples to come up with these numbers. So just a warning, be very, very careful about these serological tests that are being marketed at this moment.
Thank you, Pete. I know that is important, and I appreciate you putting that word out. So we've got a couple of courier comments, but I'm going to go to Dr. Carr's question. It says, or comments, please consider that positive predictive value of serology testing is dependent on the prevalence of the organism in the population. So even if that test has great sensitivity, it will have an unacceptable number of false positives until there's critical mass. And that's so true. And this whole study of serology and antibody testing is just way too new at this point. So it'll be interesting to see how this all pans out. So thank you everyone on that comment. Any questions about that? I'd like to go back then to the courier questions. Heather says that they have had issues down in Pawnee City. Teresa, are you still on?
Yeah, and I read that, and so that's the situation, is that it kind of goes hand in hand with the next question was, are all commercial labs participating in getting samples back to NPHL? And unfortunately, LabCorp and Quest, if they're your primary reference lab, they will not deliver samples back to us. So that's kind of where we have our struggle with getting samples out to or getting a courier out to these other places that aren't using, physicians lab or regional or the labs that participate in our courier network. So there are situations where maybe on the weekend you do have to drive it to the hub, and so we appreciate that Pawnee City's driving it down to Beatrice, and we appreciate Beatrice for helping us accept those. So I hope that helps answer your question.
Any other questions on couriers? Okay. All right. With that, I would love to hear other stories. We have just a couple more minutes if you want to share. If not, I totally understand. And we could maybe close early at this point. So I'm going to open up the mic. Any other questions?
Karen, hi, this is Mary Jo from Rivera St. Anthony's in O'Neill.
Hi.
Hi. We had the National Guard was in O'Neill collecting samples Friday.
Yes.
And I was wondering if those will, did you say they would show up in New Alert, and if I would be able to see them when those are completed? Are those kinds going to our facility?
They actually are the National Guard ones are going to the local health departments. So I'm not aware of, and Teresa might speak to that, but I'm not aware of them being available if they're outside of.
Nope, all the National Guard samples are the results are being sent. They are in New Alert, but they're in New Alert under the National Guard accounts. So if you need results, you would have to reach out to your local health department.
Okay, thank you.
You bet. Okay, last call. Well then, I'll
Karen,
go ahead.
This is Brian Lenz. Hi, Karen.
How
Brian
are you?
Lenz with Nebraska Health Lab. I'm fine, thank you. Great presentation. Really am excited that we have this way to communicate with our clients throughout the state of Nebraska. I just have some housekeeping information, and I think there's been some changes at CHI St. Francis, and I don't have that contact person's name in micro. Just wondering if there's anyone on from CHI St. Francis, if I could get their contact information. We have a project that we're working on that we need to talk to you about. So,
Anybody from CHI on? So we do have one other question. Just to confirm that only a specimen MPHL is accepting is saline and the nasal pharyngeal swab, correct? Are we accepting nasal washes or oral pharyngeals? No, we are not at this point accepting the oral pharyngeals or even the nasal wash, although they are looking, because swabs are in such short supply, I think that they are looking into other options for testing. So that remains to be seen. I have a lot of questions about saline. Can a laboratory just use their saline in the what they have in their laboratory? The problem we're having with saline is that the containers they're in leak. We've had some major problems with leakage, and so we are trying to encourage people to use our phosphate buffered saline. So we are handing out PBS saline to everyone that requests. If we get into a real crunch, we may have to go to that, but I'm hoping that's not true. And Dan does have a question about, can you explain what types of patients are being tested by the Guard? Yes, those particular, Robin, are you still on?
Yep.
Would you like to explain?
A lot of these, and I believe Brian is also on, but it's patients like surrounding these processing plants, and then the local health departments are also identifying people in their jurisdictions that need tested, sometimes surrounding long-term care facilities, large certain outbreaks, kind of focused, but also trying to get the most needed people who, or the people who most need testing. So if there's a situation, the National Guard is going there, and that's pretty much what we're sticking to at this point, not doing community-wide like testing, opening it to everybody. So it's a pretty focused set of people when they do go.
And I confess I did share with them, Robin, that it is primarily the packing sites that I think packing facilities that are important in Nebraska. So I hope that was not a bad thing to do, to share. With that being said,
no, those are important places that do need tested, and so that's why we're focusing our efforts to get those people tested.
Right. Yeah. You know, I asked the question of why are we concentrating on those versus, say, the nursing homes. The answer was that nursing homes at least have caregivers there on site. Sometimes this is not true for our packing facilities, and they are probably in more need of PPE and everything that goes along with the protection part of it. So definitely true. Just a few more questions. How do we crest the saline? Betty, I will talk to you on that in a little bit. Actually, if you email me, I will get you that form. And I don't see any other questions. Oh, yes, one more. Well, it does ask, what do you think the false negativity rate is with the testing done at NPHL and regional? Pete, are you still on? Because I think that we've discussed this before, both MPHL and regional.
Sure,
the
I'm
same test?
still here. So the sensitivity, specificity of the tests that we're running. First off, the CDC assay is considered the gold standard for COVID-19 diagnostics. It is a PCR-based assay. We feel comfortable that PCR-based assays do have a very high sensitivity and specificity. And I can't give you an exact number, but I tell you, if you go to the websites on the FDA, you'll see a 99% for both of those performances. The reason why I'm wavering a little bit here, because if you really want to get down to describing exact sensitivity of an assay, you have to do cultures. And culturing for the SARS CoV-2 virus is very difficult, and no one has done that. So I feel very comfortable that the PCR-based assays have a very high performance. I'm not comfortable with some of the more rapid tests that are out there that have been approved. And we know that the performance of those are not near as good. I hope that helps.
Yes, thank you, Pete. I'd also like to put in a plug that I think it's very important that that sensitivity rate is based on how good of a specimen is collected. I still think that on occasion we have issues with people, even with a nasopharyngeal swab, don't do the correct nasopharyngeal swab. They might only do a nasal swab. So I do believe that everybody needs to review the true methodologies of collecting that nasopharyngeal swab so that you are getting back into that area. And I think
you brought up a good point, Karen, because yes, the whole process, the pre-analytical part of this, the specimens that's being collected, the specimen collection kit, the transport media, how it's being transported, how it's being stored, all play into how good is the outcome going to be on the results that we report. So
yeah,
keep all of that in mind, because it isn't just the test itself.
Yeah. All right, with that, thank you, everyone. I think we'll go ahead and sign off and hope you have a good day. If you have any further questions, you're welcome to email me, and I appreciate your time today. Jessica, there is a video out for collection. I will send that out again. So thank you.